All right, we're just waiting, I think, one more second till she gets the Facebook Live up, and then we'll start with introductions.
Just taking a minute.
Yeah, just a quick reminder to turn off your cameras if you are not presenting today. That way everybody's connection will stay smooth. Thank you.
Yeah, it doesn't like this.
There's a lot of people. I'm glad that there's so many people who were able to get on today.
I'm going to close it out and try it again. Give me a second.
Yeah, no problem. We've got a minute. It's just 11 now, so I bet you some more people will be jumping on the line here. We'll give them. All right, we got a lot more new people. Thanks for joining. We're going to get started in just a sec. If you are not presenting today, we're asking that you turn your cameras off so that we can keep the connection pretty strong for those of us who will be speaking. That there should be if you're on video right now, there should be a button in the lower left-hand corner where you can just stop your video. We're just waiting to see if we can get this connected to Facebook Live. It is a little bit of a...
Yeah.
It takes a minute.
I wonder if it's because we have so many people.
Yeah. If it doesn't work, we can always just post the recording.
Yeah, I think we'll just get started, and I'll keep looking to see if it's going to get to Facebook Live. I see that somebody is trying to screen share, so I need to stop that. All right. All right.
All right, if you share the documents, then I'll go ahead and we'll do some introductions, and then we'll get right into it.
Sounds good.
We want to thank everybody for coming today and welcome. We are very excited to have the opportunity to talk about ensuring the rights of people with disabilities in long-term care during COVID-19. We're going to do some quick introductions and then walk through both the best practice guidance document. We're going to hear from some examples from the MCO representatives who are joining us today as we go through that. And then we are going to walk through the, oh, stop screen sharing, Sally. We're going to walk through the Your Rights During Coronavirus document, which Ashley Mathy is going to walk through with us, and she is a self-advocate leader on the Living Well Project as well as a member of People First. And at the end of the presentation, we will hopefully have some time to take some questions. You can submit those questions to us in the chat feature. And you can also, if we get Facebook Live up and running, you can also have you submit your questions on the Facebook Live comments, but we'll hold off on that as we wait to see if that's something we can actually get done. For privacy reasons and because there's a lot of people on this call and a lot of ground to cover, we're hoping that you can keep your questions to big picture questions. if you have specific questions about your situation, certainly reach out to the MCOs themselves, and they will absolutely help you resolve those issues. But for the purposes of this presentation, we're hoping that the questions will stay pretty broad. I'm going to start by introducing myself. My name is Mcnamara. I am part of the Living Well team. I'm the project coordinator. We also have Sally Flashberger. She is the project manager, and Zoom wizard, who is working to get everything happening behind the scenes. And then we also have Shannon Webb, who is the lead coach for the Living Well project. She works very closely with our pilot sites. We also have some representatives from some of the MCOs here. I'm going to give them a chance to introduce themselves. So we'll start with Inclusa. If you want to introduce yourself.
Hi, I am Nancy Tischbein. I'm a member relations manager with Inclusa.
Thanks. My Choice Family Care, Care Wisconsin, if you would like to.
Hi, my name is Mary Claire Carlson. I'm the self-advocacy specialist at My Choice Family Care, Care Wisconsin.
Thanks, Mary Claire. Okay, and then next is Community Care. James, are you? I can't see him. Can he unmute himself? Why don't we go to Lakeland Care while we see if we can find.
Good morning. I am Rose White, and I'm the Community Integration Manager for Lakeland Care.
All right, and then we'll see. It says connecting to audio now, so let's see if we can get James on to introduce himself. Well, hopefully he'll get his audio situation sorted out and we can get him to introduce himself as we move through this a little bit. I'm gonna turn it over to Sally, who's gonna talk a little bit about what the Living Well project is, and then we'll get into it.
All right, that sounds great. Thank you so much, Caitlin. I am the project manager for the Living Well grant, and it is a grant that the Board for People with Developmental Disabilities received from the Administration on Community Living. It's a 5-year grant with a focus on developing and testing approaches for improving home and community-based services for people with developmental disabilities. We are really focusing on the stay safe, stay healthy, and stay connected as kind of the tenets of the project. And we've been doing all of these updates kind of in that same realm of stay safe, stay healthy, stay connected every Wednesday. So keep looking for new updates on Wednesdays. And I'm going to turn it over to Shannon. She is our project coach.
Thanks, Sally. Mute someone here. There we go. So rights promotion is an important priority for the Board for People with Developmental Disabilities. And, you know, we know that organizations that support people with disabilities are responsible for ensuring the rights of people with disabilities, that they're protected. So sometimes those rights can be limited because of a person's specific needs. But oftentimes, you know, sometimes we see that they are unduly limited because of a lack of resources or a lack of knowledge. So this session today is really about an opportunity for us all to think both practically and creatively about how, you know, what are those best practices for keeping the rights of people with disabilities, you know, at the forefront of our thinking and our decision making as we, you know, work through this, you know, coronavirus pandemic. It's also a chance to hear from the MCOs who have collaborated with us on this rights document about how they're working internally and with their provider networks to protect member rights. So Yeah, excited to have this opportunity today to have the MCOs join us and to give specific examples as we walk through the document with you.
I think maybe James is back on, so I'm going to try to let him introduce himself. James, are you there?
I tell you guys, I miss the old days when you used to sit down together. So, I'm not very good at this sort of thing, but yeah, I figured it out one way or another. So my name is James Hollifield. I'm a behavioral health supervisor with Community Care. And I'm not sure if we were advanced past that where I need to say more at this point, or?
Nope, we're just getting started with the different rights.
Oh.
So I'm just going to get started. We should also have Anna on from Disability Rights Wisconsin. Maybe Anna, if you want to unmute yourself. I didn't necessarily see it in the queue, so. All right, great.
I'm Anna Anderson from Disability Rights Wisconsin.
Great. And Anna is one of the ombudsmen for the long-term care program. And so that brings us right to kind of one of the first areas that we think is very important for people to know. And that's really to know that people do have access to advocacy services during this time, and that they should be able to ask for assistance, and they should be able to contact the Ombuds program and know that it's their right to reach out to get advocacy. Anna, do you want to just provide us a little information about the program?
Absolutely. So the Family Care and Iris Ombudsman Program is part of Disability Rights Wisconsin, and I'm an ombudsman in that program in our Madison office. So we mostly serve people that are members of long-term care, so Family Care Partnership, or IRIS. And we serve people in a variety of ways, anywhere from answering, simple questions about the programs, making referrals to agencies that can assist, all the way to negotiation with managed care organizations or with IRIS, and sometimes we do prepare and represent in hearings. So just to give you a little, just a little taste of what we, the services that we do provide. So a lot of people call us when their services on their care plan have changed, so have been reduced or terminated. When they've asked for a service that they have been denied that request, and when something in their life has changed. So when somebody might need more assistance in their home, or they may need to move to a different living situation, and that's become difficult. People call us under those circumstances. And that's pretty much it, but we do hope that people that are in these programs that are having some problems do give us a call, because we want to make sure that your rights are maintained, and that we're helping negotiate with managed care organizations and IRIS to get so.
Excellent. Thank you so much, Anna. We really appreciate you getting on and giving a little bit of information. And we'll be sure to post the phone number in the chat too. That would be useful for everyone.
Thank you.
So when thinking about accessing your rights, and that it's important that information is given, emergency information is given to you in plain language, and that you can ask for things like audio, larger print, closed captioning, visuals, all of that. So we're going to hear a couple examples from our from the MCOs. Inclusa, would you like to give us some information around this?
Sure, thank you. Inclusa is continuing to partner with and to support providers as much as possible during this time to assure that the continued support for our members is there. Messaging has and will continue to go out to members in the form of letters or direct contact from Inclusa colleagues. Our care teams are increasing the frequency of contact with members and providers as needed during this time to continue to reassess needs and provide education and support and offer phone and video conferencing options.
That's great. And how about community care?
Yeah, we've been doing several things at community care early on, trying to stay up with the changing environment here and the needs of the member population. So one of the things we did was sent out a letter in plain and simple language describing what was occurring given the pandemic and our direction and how we would be connecting with our member population so that they would know what to expect. We developed a set of guidelines for our care teams so that the information we had, which was as current as was possible, was presented and updated routinely so that they'd have a reference or a resource place to go when interacting and sharing information with our member population and other stakeholders. We've developed a resource site that houses much of this information and have been personing the site routinely to, again, keep the information flowing as it comes to us. Part of that process has been information around best practice guidelines in terms of our treatment approaches and support approaches. And we also have a member rights come first campaign that's currently in the works, and we're folding in a number of these things into that whole process. And one of the things that we've done, if I could share this with you, is our member newsletter is called Connections. And I don't know if people can see it or not, but I figured I'd hold it up just the same. But it features what's going on with COVID-19 during this period. And then inside has different information like the need to stay at home and the reason for that during this coronavirus, different tips on staying connected and staying well, what to do if you feel sick. The situation, unfortunately, that's going on in the community with fraud and people trying to take advantage of, especially older people, older adults, or folks that they feel are disabled in some way. So perpetrating fraudulent approaches. And then also staying healthy and looking at the kinds of things that people can do in terms of diet, in terms of exercise, etc. So we continue, as I say, to update that information and interact with our provider population and members and others to look at what might be helpful and how we could contribute or incorporate that into our process.
That's great. Thanks for sharing that. So we also have heard a lot about people wanting to visit with their relatives or friends or caregivers. So developing those safe visitation options, which could include weekly FaceTimes, drive-away hellos, window meetups. We know that there have been some no visitor rules that have been enforced, and being able to create, to identify individuals who might need more assistance during this time. So thinking about how that could be difficult for people and what we can do to support them. And we're going to hear from Lakeland Care a little bit about that to start.
Thanks, Sally. So at Lakeland, our care teams, they collaborate directly with the provider member, their legal rep, or their family on coordinating what is allowable based on maybe the residential facility where that member might be residing, or if they're in the community, what is the best approach. Often we're using virtual technology such as FaceTime and Zoom video options so that the member can remain in contact with their family, their friends, and loved ones, and do that in a safe way by respecting that safer at home order, and also stay engaged and any of the social groups that they were part of so that they can remain active in that. And really all of that is just a collaborative effort to help support the members' mental health and their emotional well-being in remaining connected with others.
Great, thank you. And Mary Claire, how about you? What is My Choice doing around this? Did we lose Mary Claire?
She's muted.
All right, I'll unmute.
My apologies. Thanks,
No
Sally.
worries.
Sorry about that. In response to COVID-19, we've increased our contact with members to include weekly calls using a tool designed to help our care teams effectively provide care management telephonically. And this tool actually uses elements that you would find in the Living Well Project's COVID-19 toolkit. So it's a really great resource. I really recommend people check that out. This assists our care teams to stay connected with our members and to work collaboratively with them, their families, allies, and service providers to ensure that the needs of the members are being met. Specifically for things that have to do with no visits, we are seeing that our residential providers are assisting members with technology like FaceTime and Zoom and other types of video conferencing platforms for visits not only with family and friends, but sometimes for telehealth opportunities, virtual services, as well as virtual care management visits. Some providers have created limited exemption policies having to do with hospice or mental health. And some very creative residential providers that we're aware of have actually purchased patio equipment to allow for safe social distancing visits outside of the residence.
All great ideas. The next is regarding safety within your home and making sure to develop plans that enable people who may be living in group homes or settings where there's roommates, that people are able to safely gather together in meal times when there is no evidence of COVID present in those people, and that people should not be isolated to their rooms. You know, that unless there is an incident, you know, we shouldn't be fearful, and we should be sure to allow people to continue in the way they were in their homes. And we're going to hear from Inclusa on that.
Right, so Inclusa is guiding providers based on the guidance issued from CMS and DHS. There are currently twice weekly meetings with DQA DHS that also spends a lot of time on member rights and situations in their homes. There's Inclusa representation on these calls twice a week. For any contracted provider who has concerns regarding maintaining the rights of their members, we do encourage them to call their care team or member relations. We do want to work with them, and we have participated and will continue to participate in group discussions with the providers and the team members, decision makers, family, on how we can maintain these what may seem simple things, but at this time is not, regarding mealtime, the ability to even go outside on the deck or take a walk. And really, when is it appropriate to quarantine? We are very glad to support all our providers and continue to support these discussions moving forward.
Thank you, and I'm gonna turn it over to Shannon.
Thanks, Sally. for those of you who may not have your chat box open, just to let you know, looks like a woman named Jackie put in some information about independent living centers. Just wanting you all know that there are 8 independent living centers in Wisconsin. So they serve every county in Wisconsin, and they provide both individual and systems advocacy. So they're also a resource if people need some, help or information. You can find out where your ILC is by going to the Department of Health Services website and, searching for independent living centers. So, all right, so diving back in, I bet a lot of you have been getting out, getting some fresh air and exercise during this time, finding ways to, safely get outside. And that's really important for people with disabilities and for service providers to be supporting that. It's good for our mental health and, our physical well-being and a change of scenery. So sometimes people need some one-to-one support, or help maintaining safety, social distancing, that kind of thing. So that should absolutely be provided for people when they need it, if they need it, by service providers to get out and have plans to, safely be outside. So we'll hear from James from Community Care about this.
Okay, thank you. At Community Care, the care teams have been working consistently to maintain contact with members and others that are supporting member needs and sharing ideas basically about what's working, what isn't working, how things are shifting a bit. And you guys have maybe noticed that early on, people were responding pretty regularly and consistently to the pandemic and staying in, sheltering at home and that sort of thing. And then lately there's been more of a push. People really seem to need to get out, try to get some air, try to do something, be in contact with other people. So we're trying to stay flexible, which is a very difficult process, as you might know, because there's this balance between safety and health and making sure that people have the means to be healthy and safe, while also then being flexible enough around how that can happen. So our care teams are working pretty diligently with our population and those that provide those supports to look at how to continue to advance those efforts and to have them be effective. One of the things that occurs in that process is that the care team will call upon our behavioral health resource team. And we do what we can to contribute to the conversation of how we might maintain that balance. We may come in and sit in on phone calls. Oftentimes, there's been a past relationship with members, so we already are aware of their needs to that extent, and they're aware of our desire to help address those needs. So there might be a past or current relationship, and we're also open to and available for future relationships with this population. We look at the needs that might be present at a given moment in time, because again, things continue to shift. And the only thing that is consistent is that there's more change. And so it's real difficult to settle in and settle down. People react to that at times, especially if there's been a history of reacting to difficult situations in ways that might be counterproductive. So we're there to develop and encourage support plans when need be. If we need to look at the possibility of an elopement plan or refine elopement plans if we're going taking members out, and that may be a possibility given their history, or safety plans and what might be needed around that. So we really considered a joint effort and continue again to try and address the needs as they're being presented. Actually, at some point, perhaps before we finish, I may talk a bit about anticipation too, but in terms of crises and avoiding crises or addressing crises, oftentimes they can be avoided by expecting them to occur. And so that's one of the things that we also talk about.
All right, great. Thank you. Rose from Lakeland.
You're muted. Helps if I unmute, right? At Lakeland, we have a community resources spreadsheet that we've been collecting information because anybody that's part of this whole COVID-19 situation, you're getting loads of information coming at you left and right. So what we've been trying to do is filter that information into different categories. And really, we've been very blessed that we've been part of many external stakeholder groups or through our partnership with the Department of Health Services. They're feeding us lots of information. So we're gathering all of that, and then we share that internally with our care teams as well as the rest of our staff and providers, so that we're able to really keep pace with what's current, and current changes very, very frequently, we all know. So that gives us the opportunity to collaborate with, again, that safe at home order, as that order is evolving into different phases in our state, so that we're adhering to that with recommendations or coordination for recreation for our members. So what we've been doing is care teams have been coordinating either one-on-one activities through a supportive home care agency, for instance, or self-directed supports. So the members have the opportunity to get out and go for a walk or go to their local park. State parks at some point were closed, and we can't guarantee, again, any continued path today might change tomorrow. And also participating virtually in small groups. So even though they may not technically be, for whatever reason, able or have an opportunity to get outside, we're bringing outside in a sense to them. So they can be exercising, they can be doing physical fitness, they can be doing recreational activities within their home. It could be an art class or another activity of interest for them. And then in addition to that, our care teams also are sharing those safe practices. We're always keeping that health and safety at the forefront for the members too. So they're sharing that information with members, their legal representatives and providers on hand washing and physical distancing, again, other safe practices.
Excellent, thank you. So the next 4 bullet points are really about helping people communicate, connect with important people, with their friends, family, and having the privacy to do that. We want to make sure that people have the technology that they need to connect, and that if they want to connect with people privately in a private space, they can do that without other roommates or caregivers around. And so providers, it's really important to be thinking about how you're going to do that with people, how you're going to get them the technology, how you're going to help support them to use it. If they need, an augmentative communication device or some sort of accommodation or other sorts of assistive technology or means to communicate, that you're thinking through that for each and every individual that you support, so that they can connect with people in their lives. And also on the other side of things, that people know how to connect with them, and that you make it easy for friends, family members, other important service providers or whatnot, to be able to connect with the person. And ideally having one point of contact within your organization that does kind of coordinate that with people. And that, it's really, really important for us to remember, not just now, but always, that behavior is communication. All behavior is some form of communication. And if people are, having a hard time, having behavior that's challenging or undesired, that we really, get to the bottom of what's happening there, what the person is trying to express, and to, give them the tools and means to express themselves. So I'll hand it off to Caitlin now to go over some more.
Oh, I think my choice was maybe going to give an example of some of the technology.
Okay, sorry, I didn't have that on my
That's
list.
okay.
Oh, thanks, Shannon. Technology is one possible tool for meeting a member's needs under the challenging circumstances of COVID-19. And technology can sometimes assist a member in actually staying healthy, safe, and connected. And possible examples might include things like telehealth opportunities, the medical alert systems, access to virtual 12-step support groups, virtual classes and virtual services. And some different examples of creative responses by providers. I have permission to share this from the provider. ODC, the Opportunity Development Centers, they quickly reached out to community foundations and local businesses and secured donations to purchase tablets with data plans so that they could get those in the hands of the people that they support, so that they would have the technology to have such options, including virtual services. Other providers we've worked with have used technology along with Zoom meetings like this to bring in educational and entertainment opportunities for the people who live in their home or facility. But that same technology can then also be used to help individual members within that residential facility have those one-on-one type of communications with people who are important to them, like their family and friends. Some providers have reached out and partnered directly with families to figure out how to be able to get the technology into their space where the person themselves receiving long-term care is, so that they can use that technology. And as always, any member-specific questions or requests begin with the member's care team. So it's important to remember that care teams are available for brainstorming and creative problem solving with members and their families and service providers. And they also have at their disposal tools like RAD. You'll hear people talk about that RAD. It stands for Resource Allocation Decision. And it's a process that they're able to help explore some of those requests that people might have about technology.
Awesome, thank you, thank you. So, Caitlin, you want to take it away with some more of the guidance?
Yeah.
Or best practice guidance?
So the next one here on our list is developing procedures that are focused on using preventative and positive behavioral supports for individuals who are displaying undesired behavior. So this goes back to the things that Shannon has been talking about regarding, recognizing behavior as communication and focusing on using preventative and positive supports in order to make sure that we are recognizing those behaviors as communication and trying to discover the reason for that behavior in the most positive way possible. And then allowing the person to decide who might be the appropriate person to accompany them during a hospitalization. So this again goes to who's best able to support that person and who they have identified as somebody who is going to be able to communicate their needs and with them in the best way. We know that some issues are arising with the level of which people are able to accompany people to the hospital if they have been identified as having coronavirus, but that it's still a conversation that should be happening, including the individual who is needing the support and the people that they've identified that they trust. So we're going to hear some examples. We'll let Inclusa go first, talking about what they're doing in this.
Sure, and normally our care teams are working with members, providers, legal decision makers, other supports, and resources such as our behavioral health department or member rights departments in creating very member-specific backup plans. During this time with the COVID-19 planning, Inclusa teams have been asked to work with members and their support system and the whole team regarding plans specific to the COVID needs. So Inclusa has a COVID-specific internet site for all colleagues that provides direction around many of the topics, including backup plans. We've outlined some of the COVID-19 specific considerations around backup planning and have suggested that this plan is made for the unexpected at this point.
Thank you. And I think we're also going to hear from community care on what they are doing.
Muted here. Yes, okay. The gist of our approach around this particular aspect of the presentation is that the way that we look at this and approach it is individualized, that the members and those that are supporting the member are heard and have opportunity to be heard, and that we develop in anticipation what the needs may be relative to different facility involvement or other kinds of circumstance. Much of that can be done based on history and looking at past needs and current needs then relative to that. So we can then anticipate to some degree some behavioral, some future needs. And really talking about partnering with not only the more core team and member system involvement, but also with other facilities and providers or supporters of the member needs. So, so if someone has a need to go to an emergency room, and we know that that might be coming up, or a lot of times it'll happen in terms of law enforcement and different behavioral interactions that members may have, and or elopements. And so helping those providers understand what's at stake here and what's most effective in terms of approaching those situations. And kind of like having a suitcase ready for the baby that's coming. So you don't have to get up and worry about packing all those clothes. You just have it ready because you've anticipated the needs. And so that's pretty much our approach to that.
Great, thank you. I also just want to quickly mention that Living Well Project has put together a healthcare form and some tips on getting ready for in case you might need to, get medical attention regarding COVID. That's on our website. It's a great resource as well for helping people, pack that suitcase, as James was saying. And then kind of going right alongside that is providing assurances to people living in home and community-based residential settings as well as institutional settings that they that every effort is going to be made to let them return to their residence after hospitalization, or if there are other reasons why they might have left their home and need to come back. So, and that's kind of in the next two. But we know that that's not always possible for people to return to the place where they were living after a hospitalization. But we want to ensure that people are, getting the information regarding what's going to happen next, and giving them every assurance that if their desire is to return to that place, that every effort is being made. We're going to hear a little bit from Lakeland on their process during this.
Thanks, Caitlin. So at Lakeland, we fully believe that discharge planning begins upon admission. So whether that is admission to a hospital or institutional setting or other non-residential setting where that member is living. So whether they were living at home or whether they were living in assisted living or elsewhere. And upon learning of the hospitalization, the Lakeland Care teams connect right away. As soon as they learn of that, they connect with the hospital discharge planner, the member, or their legal rep if they have one, the provider if they have one, and other supports that they have as an interdisciplinary team effort. So this is interdisciplinary team is a multi-team effort to really coordinate what is necessary while the member is in the hospital. So it could be therapies, it could be a medication change, further testing to really get to the core of what's going on with that person. How do we need to treat them while they're here in the hospital? And then in all of that in preparation for the member to safely return home, or they may need to be looking at alternative options because perhaps that member has had an unfortunate event that occurred that now they're not able, for whatever reason, to return home. It could be that they physically no longer are able to remain in their home for the injury that maybe they received, or progression of a current condition. And the team then continues to reassess while that member is in the hospital. So they're reassessing their needs prior to discharging home, and then they're coordinating. And again, that's all with this multi-group, this multi-team, the necessary services and supports that the member may need upon their return home, so they can make sure that all of that is in place so they have a smooth and safe transition.
Thanks. All right, the next one on our list also has to do with a person's ability to remain in their current residence. So it's not specifically to hospitalization. So this may be, we're seeing some cases right now where essential workers, people with disability who have essential jobs are struggling to stay in their current residence because there's concern about them being exposed and coming back into the home because of that. And we're working on developing some rights and responsibilities that go along with working in the community now that there's a little bit more danger of catching COVID-19 while you're out in the community. And so look for that as well. But this right has to do with a change that's going to affect their ability to stay in their residence, and the person's right to have themselves and their spouse or parent or legal representative or the people that support them, as well as their care team, have a conversation about that process and what it's going to look like for them. So we're going to hear from my choice on this.
Thank you, Caitlin.
Sure.
Our care teams are at the heart of all our contact with members. And so we keep our care teams connected to COVID-19 information, DHS information through weekly care management meetings. There are meetings every week called Frequently Asked Questions, the FAQ meetings, and an internal tri-weekly newsletter. And My Choice Family Care, Care Wisconsin is also holding weekly podcasts for care teams on mental health and self-care that then they share with members during weekly calls as needed. And those weekly calls, that contact is what is so crucial. And as I mentioned earlier, much of what is in that toolkit is very similar and found within the Living Will Project's COVID-19 toolkit as well. But this includes helping the member, their families, their allies, and service providers with developing those backup plans, because it is that preventative measure, that being able to think about what could happen or what are potential things that we're going to see that are going to be so important, because circumstances are changing and evolving with COVID-19 every day, if not every few hours, every hour. And so it's not only good to have a backup plan, but it's good to have a backup plan to your backup plan. Because again, things are changing. And although in managed care, we've always had care teams that are collaborating, coordinating with a member's circle of support, it's going to be even more important during COVID-19. And sometimes it's a little bit more challenging, but what's great news is that our care teams are up to that challenge. And that's why the weekly contact is so important, because it's able to identify those potentially challenging situations, like the fact that you have a member who has a job that's as an essential worker, and they need to go out of that residence to work at their job, but you have a residential provider that is looking at health and safety concerns for all the residents who live there. And so by having that contact with your care team and the care team coordination role, it allows the team review process to work out a collective response to these situations, and to try to be, in that sense, proactive versus reactive. And so whether you're a member, a family member, or a provider, consistent and regular contact with your core team, your care team, is so important.
Thank you. All right, I think we're also going to hear a little bit from Inclusa.
Thank you. Yes, you know, when change enters our lives, it certainly shakes things up a bit. Any change can create chaos, and even more so when the change involves a lot of the unknown, the isolation and the fear. Since the beginning of the Safer at Home order, Inclusa has been directing our care teams to talk to their members, legal decision makers, families, providers about that backup plan and how the facility staff and family members, neighbors, friends, if any of them are becoming ill themselves with the COVID, how might that create a barrier in those plans being viable? So I like Mary Claire, the backup to your backup. You need to have that conversation. Care teams are also exploring technology supports for our members who may benefit from that virtual visit, but who may not otherwise have access to this technology. So that's in the works. Dr. Angela Marks is a clinical psychologist who's also bringing Inclusa opportunities to connect for education and support so that we may be better able to support our members, families, legal decision makers, and providers during this very difficult time.
Thanks so much. All right, we're at the last one on this list now, and this one we think is super important. We want to highlight that it's necessary to review any restrictive measures that are in place every 2 weeks to ensure that they are both necessary and the least restrictive means for ensuring health and safety. We want to make sure that people have the most freedom in their homes and in their choices as possible, and that any restrictive measures that are put in place for the health and safety of an individual is being consistently reviewed to make sure that it's still the most appropriate and least restrictive action necessary. We're going to hear from community care on this first.
Thank you. We realized a long time ago that restrictive measures were the least beneficial or effective way to go under most circumstances. There was a time when, as we started our restrictive measures lead position, who also is the preservation coordinator, preservation of rights coordinator. The effort was to, right at the beginning, almost like I used to work at Pathfinders years ago, kids would stay for 2 weeks and leave. And so you had to begin discharge planning at the same time you were doing the assessments for the intake. And it's the same here. Whenever we need to look at the possibility of restrictive measures, we're looking at how are we going to discontinue those measures? How would we know when it's time to do that? What are the kinds of supports that need to be in place, etc. And so in addition to staff having that kind of mindset, what we typically try to do is look at what can we say yes to rather than limiting individuals' possibilities or interests. You might imagine that there may be times where there's a bit of a struggle where a member perhaps might want to go out and have a little fresh air and spend some time. The provider might be a little hesitant about that. There's a confrontation and some difficulty. And one of the things that we acknowledge and appreciate in addition to the member desire is the difficulty of the providers who are really struggling with those same kinds of issues and concerns. And so we put together a plan where weekly, there are about 25 or so providers that we meet with. We discuss the kinds of concerns they might have in terms of these challenging behaviors and situations. We provide feedback and support, and looking at it not just again from the one level, but also from that staff level. And if we branch that out, we're looking at family or caretakers, or we're looking at providers of other nature that might also be wrestling with their difficulties. And so we try to take that approach toward least restrictive, looking at what kinds of supports can we continue to incorporate, and how can we continue to support the system at large as we look at our individual members' needs as well.
Great, thanks. And then we're going to hear from Lakeland Care quickly on what they're doing on this as well. And then we're going to move on to hearing from Ashley Mathy from People First Wisconsin. So Rose, do you want to wrap this up for us?
You bet. So thank you, Caitlin. So very similar philosophy, that James spoke of from community care. So at Lakeland, we have a member supports department, and there's various positions within this department, from a restrictive measures lead to member rights specialists. We have member support consultants that work on positive support planning and actually assist IDT staff, care teams in developing, if need be, if they have to go down the path of a restrictive measure. We also have a member advisory council where we have representation of Lakeland members that sit in on that council, that are part of that team of ensuring member rights are upheld, and they're really representing that membership piece of it. So all of that, really that department, member rights department, is that resource and support to the care team in ensuring the member rights are upheld through positive support planning, really focusing on the member's strengths and abilities. And really we believe in member rights are interwoven into almost every aspect of care coordination to help ensure members have that least restrictive treatment and setting, and that all is maintained while upholding their right to dignity and respect. So at the care team level, all the way through the organization itself.
Great, thanks. All right, I know we're getting a little close to 12 o'clock, but we still really think that it's important to hear from Ashley Mathy. So I'm going to pass it over to Sally and give her the opportunity to introduce Ashley to you. Ashley's a great self-advocate who's going to walk us through the other document that we've created that's in collaboration with the best practice document, and she's got some great insights she's going to share with us.
So are you ready to go, Ashley? Great. I put up the document that we created for people with disabilities to just make it a little easier to understand. Ashley is one of the self-advocates participating with the Living Well grant. And so I'm gonna let Ashley take it away, and she's gonna walk through these, some of the same things, but give her perspective on the different rights and how, as a person with a disability, these are so important. Take it away, Ashley.
So the first one is you have the right to get the help you need. So you can get help from an advocate. An advocate is a person who helps people with disabilities. If you need help, you can call Disability Rights Wisconsin. It just says if you need help from a doctor or a hospital, you can have the rules explained to you in a way you can understand. So for example, if you're not understanding what the doctor is saying, you can help them, ask them to rephrase it or something. You have the right to connect with your family and friends. That means you can use the computer, phone, or iPad, tablet in your home to say hello to people you want to talk to. So for me, having that ability to talk to whoever I want to when I want to, and not having someone tell me what to do, gives me a sense of purpose, gives me a sense of meaning. Having these rights as people with disabilities give us, oh, we're in life for a purpose, we're going to make a difference, and we're going to do everything everyone else does. Because I know a lot of times when we're people with disabilities, we have times where we look at the normal people and think that they got everything, but reality is it's important to have these rights. You can talk to your friends and family without your staff in a room, which is awesome, right? You don't want your parents going, oh, they're by you, and say, oh, hello. If you want to see, your caregiver can set up a way for you to say hello through a window or from a safe distance outside of your house. If you are upset that your friends and family can visit, your care manager, IRIS consultant, or service provider should help you find a way to feel better. So just always kind of communicating with your service provider and people in your life to kind of make you feel better if you don't know the resources. You have the right to do safe activities. You can go outside and take a walk or get fresh air, and even if you don't have a caregiver with you, you can hang out with your roommates. You do not have to stay in your room alone all the time. You have the right to stay in your house if you get sick. You have the right to be heard, which is self-advocacy. So you have the right to voice your opinion, and speak up for what you believe in, not even if people don't agree with you. You have the right to do that. And when you look at all these rights, you should look at it and say, I do have the right, and you should feel a sense of purpose. So I really encourage you to look at this document, maybe even share with your family and friends, and just encourage them, oh, I do have these rights, and it just makes you feel like a sense of purpose. So that's really important.
That's great. Thank you so much, Ashley. You always bring it back to the person and making sure that everybody has their rights, whether you have a disability or not. There were just a couple questions, some around technology and how to get technology approved in a plan, and what different types of technology. So obviously technology is going to be very particular to the individual. So they should be contacting their care manager or their IRIS consultant to talk about what technology they need and how it would fit within the plan. And then again, the approval process, you would have to go back to your care team or your IRIS consultant to get that taken care of. I'm not sure if any of the MCOs would want to add any information about technology around that. All right. Well, I think that we will wrap this up.
Hold on 1 second.
Okay.
1 second, Sally. There was a question from a provider to Ashley about whether or not she ever does, whether she does any speaking, and whether
Okay.
or not Ashley, you would be comfortable with us sharing some of your contact information with them in case that you could go and talk with the people that they serve. Would you be comfortable with that, Ashley? Oh, you're on mute.
I'll unmute her. Oh, wait, she's
Okay, so I do speak around the state of Wisconsin. Yeah, I can. They can definitely. You can definitely share my. I actually speak around mainly employment, but I am free to do anything. I usually put a lot of jokes in it, so it's usually not boring.
Great. We will make sure that people know how to get in contact with you if that's something that they're interested in. Thank you for being willing to, Ashley.
And we will post the video on Facebook along with the links for the all of the documents. They will also be posted on our website, which is wi-bpdd.org. and you'll look under the Living Well section for the actual documents or any contact information for myself and Caitlin if you want to follow up. So we appreciate everybody joining. Thank you to all the MCOs for participating and to Ashley. And we look forward to seeing you next week on what now we're calling Living Well Wednesdays. All right, thank you very much. We appreciate it.
Take care all.
Bye, thanks.